recognizes the gentlewoman from California, Ms. Sanchez, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I stand here today a little disheartened. Disheartened because my colleagues across the aisle seem to have forgotten about the priorities and the needs of the American people. For an unprecedented 61st time, the majority has introduced a measure that would cripple the landmark Affordable Care Act. The consequences of such a budget measure would be terrible. Millions of Americans would lose their health care insurance, and premiums for others would skyrocket. The majority's claims that the ACA somehow is ineffective or costly or illegal, they claim that it doesn't work. Well, they're just wrong. Mr. Speaker, the Affordable Care Act is working. It's been working. It's been working in my hometown. It's been working in Orange County, California. Under the Affordable Care Act, the CHIP, and Medicaid, we have expanded insurance to over 12.3 million individuals. 2.6 million of those individuals are Latinos. Cost under the ACA has been greatly reduced, and the ACA is projected to save the United States $200 billion in the next decade and over $1 trillion in the second decade. I would say that those statistics speak to the success of the Affordable Care Act. The ACA has had great success back home in my home district. In Orange County, we were the highest number of new people into the health care benefit exchange that we have in California. Currently, there are more than 1.3 million Californians that now have health insurance that didn't have it before. See, Mr. Speaker, before the enactment of the ACA, the folks in my district, well, they considered it a luxury. They chose between buying clothes for their kids to go to school or putting food on the table, or worse, they used home remedies. I know, because I grew up on home remedies. I grew up not going to the doctor. I grew up trying all these crazy things at home, having a simple flu and being out of school for 10 days because we couldn't afford to go to the doctor. It's pretty unacceptable in today's time, Mr. Speaker. In the greatest country in the world, health care should be a right, not a privilege. We need to continue moving forward. We need to continue moving our communities from a culture of coping to a culture of coverage. No longer do people have to worry about being denied for their existing health conditions. Quality health insurance is now available to all who seek it. Because nearly 4 out of every 10 people in my district are Medicare recipients, I understand how important this legislation is for working families. So I will continue to work to join with my community-based organizations to ensure that our people are covered. So tomorrow, when my colleagues across the aisle once again vote number 61 to defund the Affordable Care Act, I'd like for them to think about all the families in America that will suffer when that is passed. Think of all the families. Think about all the kids under home remedies. My colleagues in the minority and I have stood up. We've tried to explain to the other side the importance of the Affordable Care Act, only to have our passionate voices fall on deaf ears. And despite these continuous attacks against an existing law which has improved the lives of millions of Americans, I will continue to fight for quality health care for the folks back home in my district. And, Mr. Speaker, I yield back.
The gentlewoman